Hello, I'm Annie Safarian, Associate Marriage and Family Therapist at Embracing You Therapy. I'm here to talk to you today about the signs of ADD or ADHD in adult women. What is ADHD? Attention Deficit Hyperactivity Disorder, or Attention Deficit Disorder, is a persistent pattern of inattention or hyperactivity, impulsivity that interferes with your social, academic, or occupational functioning. Some of the most common characteristics of ADHD in women are related to inattention. This may look like failing to give close attention to details or making careless mistakes at work. Often this person has difficulty sustaining attention in tasks or play activities. Things that require focus, like listening to a lecture, having a conversation, or doing a lengthy reading. So these are the women who have all the good intentions to read through the pile of books on their nightstand, but can't seem to finish. Conversely, some others hyperfocus and read an entire book in one sitting, which may affect them finishing other more pressing tasks in their day. Often this person does not seem to listen when spoken to directly, and it's as if their mind is elsewhere, even if there's no obvious distractions. Some women with ADHD may present with an auditory processing issue, meaning you may just tune out sensory information, especially when being given verbal instructions or listening to a speech. These women may also get overstimulated in loud environments or around a large group of people. Some women with ADHD often do not follow through on instructions and fail to finish work, chores, or other duties. They quickly lose focus and become easily sidetracked. The ADHD mind loves novelty. These women usually overcommit or overextend themselves with hobbies, DIY projects, and other work, but often they fail to complete the task. Women with ADHD may also struggle with procrastination. Since this disorder affects executive function skills like planning and organization, it may be difficult for some to give themselves adequate time to complete things. Time blindness, as it's called, leads to some over or underestimating how long something will take to finish. When we've underestimated due to poor executive function skills, the task can seem overwhelming, leading a person to simply give up. Conversely, working under a tight deadline may send someone into a hyperfocus, thus perpetuating their belief that they work best under pressure. In some cases, there is also a need for perfection. If I can't execute this project perfectly, why should I even try? Often these people have difficulty organizing their tasks and daily activities. These are the people who may have trouble filling out applications, preparing reports, filling out forms. Often they lose things necessary for their tasks or activities. So these are the folks who are constantly misplacing their house keys, their wallets, and cell phones. Chronic disorganization is typical. These are the people who have to also sometimes clear their desks off completely before being able to focus. So there is definitely a spectrum of the experience as far as organization and focus are concerned. The ADHD woman is often easily distracted by other extraneous stimuli. So things in our immediate environment can be very interesting when we're trying to focus on a mundane task that needs to be finished. And that's very difficult for the ADHD brain to do because it craves novelty, something exciting, something that we enjoy to do, not necessarily the mundane administrative tasks of the day. So scrolling through social media allows for the brain to receive many hits of dopamine, which is the neurotransmitter related to pleasure. and allows for the ADHD woman to get easily sidetracked, losing all sense of time. So while we've heard about the more typical hyperactive presentation of ADHD, where little boys are unable to sit still or interrupt others, many women present as the more inattentive type. These are the girls who learn to mask their symptoms and push through, right? So however, the burden can become bigger and bigger and bigger to bear as these girls grow up into women who enter the workforce, get into relationships, raise children. And so the coping strategies they used to work in the past are no longer effective, causing them to become overwhelmed. If you feel you or someone you know is exhibiting some of the symptoms discussed in this video, please have them contact a trained mental health provider. Help is out there. And of course, we're here. Call us for a free consultation today. Thank you so much.